Hi everyone. It's really a great pleasure for me to welcome Professor Anton Luger to Porto, to the Portuguese Congress of Endocrinology. It's really a privilege to have this opportunity to have an interview that hopefully will help us increase our knowledge in the pituitary neuroendocrinology field, but also to inspire our careers as an early career scientists and clinicians who work in the field of pituitary and neuroendocrinology. We all know Professor Luger. He has an outstanding career. He developed most of his career in the Medical University Hospital of Vienna. Also has taken several roles in many associations, societies, the European Society for Endocrinology, and also very importantly to our NAS Society, where he served as an EXCO member for some time. His main scientific interests as related to pituitary, neuroendocrinology, and endocrine tumors, but also diabetes and other areas. Anton Luger, your talk today was about pituitary tumors in pregnancy. Would you wrap up the main highlights from your speak today?
With pleasure. So it's very important that women of reproductive age who receive the diagnosis of pituitary adenoma are informed from beginning on about fertility and also about pregnancy outcome. In patients with microadenomas, be it non-functioning or prolactin secreting adenomas, the chance of symptomatic tumor growth is very low, and therefore there is no need for close monitoring by an endocrinologist throughout pregnancy. This is completely in contrast to patients with macroadenomas, with acromegaly or with Cushing disease, where the close observation and the contact of a pituitary tumor center of excellence with specialists through the different specialties is strongly indicated. The women with Cushing disease should not get pregnant. Safety for the fetus and for the mother of bromocriptine and carbaglin is very well documented. Although there's much less evidence, this seems to apply also for lanreotide and octreotide.
You mentioned the pituitary tumor centers of excellence, and we all know that pituitary patients strongly benefit from a multidisciplinary approach. What do you think are the special considerations, and how should a team like MDT team should be composed for women wishing with a pituitary condition, wishing to become pregnant, or a pregnant women, and how should we interface or interact with our gynecology colleagues?
Yeah, of course, for me as an endocrinologist with a background in internal medicine, of course the endocrinologist is the central person who should be part of a multidisciplinary team, of course also endocrine nurse. Very importantly, the participation of an expert neurosurgeon, and possibly also, if the neurosurgeon is not the expert in radiosurgery, also radiosurgeon. In addition, a radiologist should be part in any case, and also the pathologist. And in some cases, the recommendation will benefit from the presence of a gynecologist, obstetrician, and also of a neuro-ophthalmologist.
And the role of gynecologists, you think they should be part in the planning process for women wishing pregnancy, or we just refer when?
Well, I think their role, if there are problems with fertility, and if there's the decision how the delivery should be planned. Also, if there is some complication, the preterm delivery should be considered after gestational week 32. So there's a role, of course there's a role for gynecologists and obstetrician, but not for every case. And people who should decide upon that is the core team consisting of the endocrinologist, the endocrine nurse, and the expert neurosurgeon, and the pathologist, and then the radiologist, and also in some cases the radiosurgeon.
I would like to maybe ask you one or two advices for early career clinicians, researchers wanting to become a leading expert in this interesting field.
Well, my answer might be biased, and I'm convinced that this is somewhat different between a clinician scientist and a basic researcher. So for a doctor who takes care of patients and treats patients, it's of paramount importance that he or she devotes enough time to improve, to get enough clinical experience to become the person where patient would like to seek advice, not only patients but also colleagues. But the problem in the career is that it's very difficult to measure clinical skills and knowledge for an endocrinologist. And so in the academic world, mostly the output of the scientific output is measured, because this can be done much more easily through EYRC index, and not the number of publications is not so relevant, but the EYRC index, the citations, the number of citations, this is available very easily. So in the career for the different steps, this is what is used most commonly. And this represents only a small part of what I would expect from an expert. The teaching capacity or teaching experience is almost always neglected. I think it's suboptimal, but we have to live with it, because it's, as I mentioned, it's difficult to measure clinical skills and knowledge. For researchers, it's different. So only the two last things apply: the teaching experience and the research output.
One last question about an advice or a tip to how to find a good balance between your professional and your personal life. So this work-life balance that we all deem to find so much.
Well, this is a very difficult question. I think for me, the central thing is the fascination for our field, so the fascination for endocrinology, neuroendocrinology. This is the central thing, because if you're happy in your job, the likelihood that you're happy in your private life is much, much higher, and vice versa. If you're happy in your private life, I think that the chances that you're happy in your job and also perform very well are much, much higher. Of course, this is very difficult to achieve with the goal that are set, what you want to achieve in your profession. But the other thing which I think is fundamental is to keep your mind open to everything, not only to medicine, not only to endocrinology, to all new developments and outside of medicine, music, art, literature, theater, opera, whatever. And I think if you are open in that direction, you will also be open in your profession, and this will benefit also your satisfaction in your job.
Anton, thank you very much for your availability and for your time to share this knowledge, but also this very insightful advice to all of us, early career endocrinologists, trying to find a way and pursuing an academic career, but also having a good balance with our personal life. I hope this inspires all of you, and Anton, I wish you a great time in Porto. Thank you very much.
Thank you very much for your difficult questions.